Sweet. We are live, and I am excited for today. Talking about
Good.
GLP-1s.
Nice.
Very exciting topic because how popular they are. People are, um, yeah, I mean, all the time you hear about them over the news. So much false information out there. We already got 25
Yeah.
people who've joined us. We
Oh, great. I
just
hope we have a
started.
lot of comments. I want people to comment, ask their questions,
Yeah,
so we can provide some clarity on this stuff for sure.
Yeah, well, we're waiting for people to roll in here, guys. Why don't you people are joining us live? We love to interact with you. Comment, let us know where you're from. Hey, what's going on? What's going on,
Hey,
Brandy? Thanks
everybody.
for commenting. Yeah, guys, say hey, give us an emoji. We love having you here with us. So today is going to be on GLP-1. Like I was just saying, we're going to be primarily focused on weight loss, but also some of the other kind of applications of them. We're going to be talking about myths, applications, when not to use them,
Yep.
conventional medicine, functional medicine. Everything we're talking about today, this is not medical advice. This is for educational purposes only. We
Right.
are going to be doing some Q&A at the end. So if you guys are going to ask questions, just make sure they're broad. Don't ask like questions relating to yourself. Otherwise, we're going to change the question or we're going to skip it. So make you can ask questions, make sure they're broad and not like, hey, should I take this drug? We're not going to answer that. So, that said, Dr. Renard, for those who don't know you, why don't you give a little context and kind of like your background and your expertise with peptides and more specifically GLP-1s?
Sure. Yeah, I'm Dr. Colin Bernard. I'm one of the providers at MedMatrix. I have a broad background. I'm multiple board certified in chiropractic medicine, natural medicine. I have fellowship training in functional medicine. I practice medicine as a PA. I'm also a diplomate with the American Academy of Anti-Aging Medicine. So I've learned a lot of peptides through some of my additional like postgraduate training, and use peptides a lot in MedMatrix, use peptides for myself, educate my friends on peptides. It's become a huge thing in my day to day. So we use a lot of peptides at MedMatrix. Patients love them. Patients are getting great results. But there's unfortunately a lot of information online, a lot of things in the stratosphere that can confuse people about peptides, specifically the GLP-1 peptides. So something we want to talk a lot about today.
Yeah. Okay. Let's
Yeah,
just start. Let's start from the ground up. Like, what are
sure.
GLP-1?
So a GLP-1, it stands for glucagon-like peptide 1. So glucagon-like peptide is a hormone that's naturally produced in the gut, and it regulates a lot of things in the body, such as your blood sugar. It slows down your digestion, and it signals, one of the things it actually does for appetite is it signals fullness to the brain after you eat. So when we translate this to big pharma, or medication, what they've done is they have created a synthetic version of the GLP-1. That's how they were able to patent the peptide in a medication form. So the synthetic version of the GLP-1s, they're known as GLP-1 receptor agonists, and these are the pharmaceutical medications: Ozempic, Wegovy, Mounjaro, aka semaglutide, tirzepatide, liraglutide. Um, and they're predominantly used to treat diabetes, type 2 diabetes, and obesity by mimicking this specific hormone. So that's kind of the bread and butter of what they are. They're basically stimulating insulin production when blood sugar is high. So the insulin is the major hormone that controls your blood sugar. When you have high blood sugar, it stimulates insulin to reduce it, and it helps stabilize glucose levels. So that's like basic 101 of GLP-1s.
You say basic, but that was a lot of it.
Sorry, that's as basic as I can make it. Yeah.
Okay, let's try to make it even more basic. I'm going to
Okay.
challenge you with this question. In 30 seconds or less, how do GLP-1s actually help you lose weight? What's the basic mechanism simply described that helps you lose weight?
So basic mechanism is they slow down how fast the stomach empties, number one. They keep you feeling full longer, number two, and they act on the brain to reduce cravings and reduce your appetite. That's like a very basic three-pronged approach of what the GLP-1 does in the body.
Okay.
We can certainly talk about all the other significant things it's doing, and I think we should, because this isn't just like a weight loss drug. It really changes your metabolism, but that's kind of a basic principle of what it's doing.
Totally. Yeah, and we're going to
Yeah.
get into that today. We're going to dive deep into
Good.
GLP-1s, what they are, why, how they work. I guess where do you think would be important? Because we're educating people on GLP-1s here. So where do you think would be important for us to go next, just on this like GLP-1 education journey? What do you think is important to know?
I think it's important to really talk about they're being marketed to people, significantly to treat obesity, but it's much more than that. So I really think we need to take a deep dive into what the GLP-1 is doing in the body and the different body systems. So it's not necessarily just, oh, take this drug to lose weight. It's really changing your entire metabolism and the way your body reacts to food, the way you interpret food mentally, and also like physiologic response to food. So there's a lot of really cool physiologic changes that the GLP-1s are acting on. So I think that's something we need to dive into. And we can sort of talk about how the GLP-1 affects multiple layers of the metabolism simultaneously. That's, I think, a really great place to start. Yeah,
that's
not just your appetite.
Yeah, let's do that, because I think when a lot of people who are maybe not as educated as you per se would think, okay, weight loss is all about metabolism. So let's dive in. How do GLP-1s affect your metabolism?
Yeah, so GLP-1s work when so many other like diets or other types of weight loss medications fail, because it is affecting, as I said, multiple layers of the metabolism simultaneously. It's not just reducing your appetite. It's not just saying, oh, I'm going to eat less, so I'm going to lose weight. And as we've talked about on this podcast, specifically, I've said it many times, you can't just eat less and lose weight. That's totally counterintuitive. So really what's going on with the GLP-1 is they're changing several systems that are often dysfunctional in the body, and in patients with obesity and metabolic disease. So the first one, and then we can stop in between if we want to talk and comment. The first one is the brain. So on the GLP-1 on the brain, it increases satiety signals, basically feelings of being full, okay, when you eat. It reduces food noise. So food noise is like a quote unquote kind of like we call it food noise. It's a term that really is this little thing here, like eat something, right? Yeah. Like emotional eating, reward driven eating, right? Why do we eat food that feels good? Why do we sit and eat an entire bag of popcorn? Because it feels good, right? There's a reward from it. There's like this spike in dopamine and some of your neurotransmitters that feels good from eating these foods. So the GLP-1 can kind of shut that off. So it lowers cravings for highly palatable foods, which is really important. Right, a lot of people struggle with obesity or metabolic issues because they don't know how to control this like insane drive to eat, especially poor quality food. So the brain's set point for hunger really shifts down, and it prevents that strong biological drive to eat, which is really, really cool, because if you do this for long enough, it will rewire how you like your emotional relationship with food, really. Yeah. And that's one of the biggest reasons why people fail at weight loss, is they do not know how to change their emotional relationship with food. And that is an insanely important part of weight loss journeys for people. So that's a really important thing.
Gotcha. So one thing that I think is really important to address is this being a pharmaceutical, because a lot of patients who, well, I guess let me ask you this. Are you like anti-big pharma?
No. I prescribe medication every day. So I'm certainly
what's the difference? Because a lot of people come to functional medicine because they don't want that like pill forward approach, right? They don't want to just be a pill for every ill, cover up your symptoms with pills. And, GLP-1s, if you go on social media, you'll see some people love them, some people hate them. So I guess like the point of this, big part of like what we're doing today is about kind of like finding the middle ground and like, when it's reasonable, like what is different about a GLP-1 versus like kind of your typical pharmaceutical drug, does that make sense?
Well, a GLP-1 is a pharmaceutical drug. We need to make that clear. It's not that it's not a natural thing. GLP-1s occur naturally in the body, but the medications are synthetic forms of what's naturally occurring in the body. So we have to remember that. The way I explain it to my patients and the way I sort of illustrate this as part of people's treatment plans is as a tool, right? We use this as a tool, because as we're going to continue to talk, the GLP-1 is being utilized not just for weight loss, it's being used to change the physiology of your metabolism, change your relationship with food. So there's a lot of really positive benefits that we can get out of using it, but we have to look at it as a risk benefit analysis, right? There are risks. There are long-term effects that we don't know a lot about. It's still a fairly new drug. And we have to be concerned about what happens when the drug is stopped, which we can get into probably later in the podcast after we review some of these other things. But it is a tool. And we also need to talk about what you do with it. It's not just and I've said this before on the podcast when we've talked about other types of peptides. Peptides, specifically GLP-1s, are not a free-for-all. Like, oh, here you go. Here's your weight loss injection once a week, and you can go eat Krispy Kreme every day and run through Burger King and McDonald's and just eat really bad food all the time. That's not, it doesn't give you license to just go haywire. You really have to change your lifestyle. You have to change your eating habits. And that's how people become successful with the drug, is as a tool to get to their goals. So it is not just a set it and forget it, free for all, do what you want.
Okay. So, gotcha. Yeah. I guess what I was getting at, because we've done a lot of these shows together already, and we did a whole episode on statin medications and talking about big pharma. And you seem to be a lot more open-minded about GLP-1s than you do to things like statins or other pharmaceuticals. Why do you like the GLP-1 drug more than kind of some of the more common pharmaceuticals, I guess, is what I'm getting at.
Well, it's not that it's so you're right. I mean, there are certain pharmaceuticals that I think are overprescribed or just not prescribed in the right way. I'm not a huge, if patients come in and they say, I want to lose weight, my immediate reaction is not, okay, GLP-1, bye. Here's your script. Have a nice day. I'll see you in 3 months. That's not really, that's not necessarily my immediate reaction, but it is a tool, right? It is a tool. And especially if patients have significant, and I'll call it disease process. I know that's a little bit of a harsh word, but when we talk about certain disease process, like really, really uncontrolled diabetes, really, really bad metabolic syndrome, which could consist of high blood pressure, significant obesity, heart disease, right? Using these drugs as a tool could start to lower patients' risk of some of these long-term complications from these issues and these chronic diseases, while we are almost training the patient to change the way they live and change the way they have a relationship with food, change lifestyle. So I make it very clear that this is a tool that we use. This isn't just a, set it and forget it, but it doesn't come without risks, which we'll talk about too. But it is something that I feel can be used in a very appropriate way under really close monitoring with their provider. And then I'll touch on this. It's not really what we're talking about on this podcast, but there's a lot of new evidence that the GLP-1 medications are being used for other types of complex chronic illness. We've talked about mast cell activation syndrome, which is a very complex multi-system immune system dysfunction issue. It's being used in patients with immune dysregulation, autoimmune disease. So we're seeing benefits of these drugs far beyond just weight loss and metabolic disease. So I think there's a lot of promise here, but they're new. Right. And I think using them in a controlled environment is important. So it's a balance. Totally.
So GLP-1s for autoimmune, can you expand on that?
Well, the not to get too far off topic, but the GLP-1s are highly anti-inflammatory, some of them. So, and they can also reduce immune-driven inflammatory response. So they're being studied in patients with complex autoimmune conditions, complex immunodeficiency, long COVID, things like, MCAS, which we've talked about a lot. So they're going far beyond just weight loss because of how they affect inflammation in the body, and that's one of the primary things that it's doing.
How does a GLP-1 reduce inflammation in the body?
It affects certain inflammatory cells. We call them inflammatory cytokines. So inflammatory cytokines are cells that drive inflammation. So the GLP-1 reduces them, and the GLP-1 also has direct effect on certain immune cells. calming them down, making them less reactive. So there is definitely promise with some of those things. But again, long term, are we going to all shoot ourselves in the foot in 10 years for doing this? I don't know, right? These drugs are still fairly new. We're still trying to understand, can people be on these for 10 or 20 years? We don't know that yet. It hasn't been long enough. So,
right. Well,
yeah.
your goal, from my understanding, right, is you use it as a tool, like you've been saying, to get patients
Right.
to lose the weight and then get them off of it. Is that right?
That's primarily the goal, right? Is to say, okay, let's use this. Maybe we use it for 6 months, a year, 2 years, something like that. But the goal is to not just be on it and say, okay, here you go, lose weight, have a happy life. It's really a process, right? It's a patient comes to me with heart disease, diabetes, they're 100 pounds overweight, right? If I use this as a tool in conjunction with a lot of other things I can use as part of my arsenal in my toolbox, this patient could significantly lower their risk of a stroke or a heart attack or early death, right? If they were to lose that 50, 100 pounds, plus they may not be diabetic anymore, right? And the way it rewires your brain with the signaling we talked about, but none of these effects are permanent. That's the thing. I want to make that very clear. And that's what I tell my patients. None of the positive benefits or these benefits that you get while you're on the drug is long term. So really what's happening with the drug is the medication controls dysfunctional physiology, but it doesn't permanently fix it. So it's my job, and that's sort of the tenet of functional medicine, is to say, okay, we can use this to accomplish a goal, but we still need to change you. Something is going wrong. We need to change dietary habits. We need to change your lifestyle. We need to change gut microbiome. We need to optimize hormone health. We need to do all these things. And in the process of using this drug over a year, 6 months, 2 years, whatever it is, we're doing other things so that hopefully at the other side of it, if we do come off the drug, the person is a whole different person, right? It's a 180 from where they started. So we're not seeing the immediate just, weight gain and it all back to normal. And that's really the importance, I think, of working with a skilled provider on GLP-1s rather than getting it off of a commercial on TV, right? You're just going to take it and no one's going to monitor you. No one's going to work with you. You're just going to take it and hope for the best. So, yeah. But
okay.
But
we're definitely going to get into I guess that kind of leads me into a good question, which is the contingencies of going on a GLP-1. I imagine,
sure.
And I may be wrong here. This may be a dumb statement in question, which is are there certain things that you would see in a patient? Because, when you see a new patient at MedMatrix, we do a full workup on them, tons of testing before they come in, intake. You spend a lot of time preparing for them. Are there certain things that let's say their hormones are out of balance or they're deficient in all these certain things they need in their body? Are there certain prerequisites that you would want to make sure are squared away before you put a patient on a GLP-1, like hormones, for example?
Not necessarily, because we can do things concurrently. There are certain contraindications to GLP-1s, right? You can't have, severe pancreatitis. You can't have multiple endocrine neoplasia type 2, which is a type of tumor growth issue. You can't have, if you have severe GI motility issues, if active cancer. I mean, there's certain things that are contraindicated, but you can certainly, if a patient comes in and they're, as I've said, really, really metabolically dysfunctional, severely overweight, at risk of a heart attack any second, right? Severe diabetes, they got blood pressure issues, inflamed really bad. We can start to use this in the beginning and say, okay, let's use this as a tool to start controlling the weight. It'll control inflammation. It will start changing the way you rely on food. It will start changing your relationship with food. And then, give that 6 weeks, 8 weeks, see how they respond. And then we do other things. Are they perimenopausal? Are they postmenopausal? Is it a low testosterone man? Do they have issues with working out? Are they, we're talking about diet at each visit, right? Okay, how's your diet changed from last time I saw you? What's your relationship with food? What kind of choices are you making? Are you getting enough protein? And then we're working on all these other things as we go through the journey. So that's really where the guided part of what we do is important. But you can do a lot of things concurrently with GLP-1s very safely.
Okay.
Yeah.
What are you like, in your opinion, are the top 3 important things you need to be doing if you're going to go on like a GLP-1?
Like I don't know if I understand what you're asking. Like top 3 important things. Like,
yeah, like that you need to be addressing. So like lifestyle, I know is one of them. And then
sure.
other 2, maybe it's hormones, maybe it's sleep, maybe, I don't know what it is.
Well, the thing that I want to be clear about, and this is, and we've sort of can come back to some of the things that the GLP-1's doing on the body, which can kind of answer this question too a little bit. But one thing that we have to understand is the GLP-1s don't fix everything. So, like I said, what we think and the evidence in the medical research suggests that the medication controls the physiology of the body that's dysfunctional. It doesn't permanently fix anything. So we have to talk about people's stress, right? Chronic stress, cortisol dysregulation is big. If there's gut microbiome issues, that's really big. If there's significant ultra processed food exposure, that's a big thing. Like you mentioned, sleep, another big thing. So those are some really big things that really play into the overall well-being of a patient long term. So those are things we really need to work on. We can't just ignore those and let the GLP-1 just magically do everything. It's not how it works.
Yeah. So does being stressed and having like a messed up adrenals and cortisol make it almost impossible to lose weight?
It can. Yeah.
Really? How?
It can significantly drive weight changes because when you're in a chronic stressed state, whether you have really high cortisol, which is your major stress hormone, or you've sort of burned out your cortisol and you have really no gas left in the tank, it's really, really hard to control your blood sugar. And the stress response can sometimes like override the benefit of the GLP-1, right? You could inject your GLP-1 all day, every day if you wanted. You might be sort of like trying to build a sandcastle underwater. It might not get you very far. So there has to be work in other regions. And I say that I educate patients on all that all the time. It's like, listen, we can do this, but you got to do the work, man. This is not just a free ride. There's A, B, C, D things we have to work on to really optimize your longevity long term and really give your body the chance for it to lose the weight you want, heal the way it needs to heal. That's a really important part of it.
Yeah. Wow. So, okay. If someone is chronically stressed, should they figure out the stress part before going on a GLP-1?
No, not necessarily, because, how easy is it if a patient's coming to me and really struggling and their health is not great and they have a really stressful life and they've had no success with other doctors or other specialists and they're like, please help me, I really need help, I'm really struggling. And I say, well, fix your stress. How easy is that to do, right? Stress could be relationship, it could be home life, children, work, financial. There could be so many things that are not immediately actionable in a patient's life that contribute to stress. So the goal is to recognize that it's important, start working on what needs to be worked on, and improve as we go. Do our best, right? Recognizing that this is an important part. Things will still work, right? The drug will still work, but we need to try to find a balance so that it can be optimal and they can get the results they're looking for.
Gotcha. Okay.
Yeah.
Let's see. I guess you talked about kind of like the difference between getting it online, right, versus coming into a clinic like MedMatrix that's very personalized and there's a lot of support. Why is that support component so important for going on a GLP-1?
Yeah, the support component is really important because these medications don't come without risks, right? And I can use this opportunity to talk about some of the most common things. So some of the most common like short-term side effects that we see are GI issues, nausea, bloating, diarrhea, constipation, rarely vomiting. Some patients might get fatigue or low energy. They might have reduced exercise intolerance. Some patients can get dehydrated really easily. And then we need to talk about separately, because I think it's important, but the weight muscle changes in the body. So when there are rapid weight loss effects on the body, and it can affect muscle metabolism. So that is something we have to be mindful of, is muscle wasting, muscle loss. So when you are working with someone that has a lot of knowledge on this and does it all the time, you can really get a personalized approach, and we can change the dose, right? Maybe I start the dose at a lower than a standard, right? Because the patient is more sensitive to drugs, or because I might not think they need a full amount, so that it reduces potential side effects. We're working on diet, right? I can educate them on the proper things they need to do to prevent muscle wasting, and ways to control their blood sugar with diet. And we can talk about stress, and we can talk about their gut health, and we can talk about their hormones. So when you just get a GLP-1, and I'm not saying it's bad, but when you get a GLP-1 on, these online companies, they just mail it to you. They follow an algorithm. You're not getting a lot of support. So it's tough. And then it's sort of an open-ended treatment plan. Well, like, how long am I on this? Like, is this a forever thing? What do I do after? Who's guiding me? I think it creates potentially more issues long term. That's my opinion with some of those, with some of the companies that administer GLP-1s without a lot of support.
Gotcha. Yeah.
Yeah.
I guess let's talk a little bit about the different GLP-1s real quick. So you
Sure.
mentioned in kind of like that personalized support.
Yeah.
What's the difference between semaglutide and tirzepatide? Those are the main two ones, right?
Yes. So semaglutide is better known as Ozempic. That was the first generation. It is strictly a GLP-1. So it's the glucagon-like peptide 1 hormone signal that it's affecting. Ozempic was very popular for a long time, has more side effects. Don't really use it too much anymore because of that. And there's some potential stronger long-term effects that we're seeing with Ozempic that may be an issue. So it's not my favorite to use. Tirzepatide is a second generation GLP-1 because it acts on the GLP-1 receptor, which we've talked about, and also the GIP receptor. It's a separate receptor. So because of that reason, it's two different receptors. It has less side effect potential and also more anti-inflammatory effects. So tirzepatide is the one that's really being studied for chronic immune issues, complex COVID issues, MCAS, autoimmunity, because of the hormone signaling. So my preference is using tirzepatide mostly, which the brand names of that are Wegovy, Mounjaro, and Zepbound. Wegovy is semaglutide. So Mounjaro and Zepbound are tirzepatide. So those are the more commonly used, in my opinion, nowadays. Not that Ozempic is not used. It's just, I think it's fallen out of favor a little bit.
Gotcha.
Yeah.
All right. Then I wanted to circle back on one thing you mentioned, which was dosing, because one of the, things that we've talked about, I've heard online, is when you go through the brand names and not, I know everything we do is customized per the patient. They have predetermined dosing, right? Because that's the way FDA approval works, where a certain dose gets approved for a certain outcome, and normal doctors aren't really able to go outside of that. Can you explain that a little bit more?
Well, that's not entirely true now. So for a while, the GLP-1s were available only in what we call an auto-injector pen. So it's a pen, it's like a automated syringe that you set, has a dial on it, and you have to set the dose, and you can't change it. It comes in certain dose like frequencies, the way you set the dial. If you want to change the dose, you can't alter that. and you just, put it up to your skin, you push a button and it injects it for you. The reason why, so there's nothing wrong with that, but if patients are wanting to use the dose, well, if their provider, the patient, decide that the dose is maybe, we want to start at a lower dose than the standard, or if we're using it, say, for some sort of complex issue like an MCAS, we use it microdosing. Microdosing really means that the dose is very, very small, which you cannot accomplish with an auto-injector pen. You really need a liquid vial so you can titrate yourself with an insulin syringe. So nowadays, though, the pharmaceutical companies are dispensing tirzepatide in the liquid vial, not in the auto-injector pen. So you can do a little bit of changing of the titration on your own, because this is becoming more customary in the mainstream world to change the dose from the standards. But it can be still very hard to get. Insurance is tough, insurance verification. The drug is very expensive. I just want to make that clear. It's not an inexpensive thing to use, whether you're doing an auto-injector pen or compounding like we do, or it is not an inexpensive thing. And sometimes insurance, even if you qualify for it medically, insurance is still not paying all of it. People still might pay for $700 a month after their insurance has paid something. So it can be an expensive thing, but I try to educate patients all the time and say, listen, this doesn't have to be forever. It might be 6 months, it might be a year. And sometimes compounding the way we do it actually turns out to be cheaper without insurance. That's why we do it that way.
Yeah.
So,
and not to mention the opportunity cost of losing weight, as far as money you'll save in the future, the quality of life.
Exactly. Yeah. That's a really great thing to point out. It might be a financial investment now, but what are you gaining in 20 years? There might not be a price to that. Your health long-term from the work we're doing with this medication might be priceless. And I know that sounds very it's very like Hallmark card, but it's true. There is a lot of potential long-term benefit, and the cost of that sometimes is priceless. So for sure, it's a great point.
Yeah. Hey, Brittany, thanks for the comment. Hopefully you can watch the full thing. This has been great, guys. I hope everyone in the comments is learning. I'm definitely learning a lot. I'm having fun. We're got about 30 minutes left here. So guys, let us know you're enjoying it. Shoot some comments, start putting some questions down there.
We'd love to answer questions.
Yeah, we love answering questions.
So
I guess the insurance, I'm just going to ask some questions for the people. It's like, why does insurance not cover GLP-1s? Like, you think, and this is kind of just like what's your opinion answer, because it makes sense. I mean, right? It's like, don't you think insurance companies would want so many chronic diseases tied to being overweight? Like, don't you think insurance companies would want to pay for this and get ahead of disease? And even especially if they qualify for it, like, what's up with insurance companies and GLP-1s?
Well, it's not that they're not covering it. They do cover it. It's just the problem comes down to patients' insurance coverage plans. Do they have deductibles, right? Do they have pharmaceutical deductibles that they have to meet before the insurance will kick in fully? So it goes back to, and I said it yesterday on our podcast, I say it almost every podcast we do, that it just goes back to a broken healthcare system model. So you're 100% right. Shouldn't the insurance company want to cover this for patients because of the potential outcomes? They're not looking at it that way. They're looking at dollars and cents on a screen in a spreadsheet, right? If a patient, and this is a problem with insurance as insurance evolves or as time goes on, patients' private health insurance plans are getting more and more expensive each month for them to have. They're paying more out of pocket. And they're also paying higher deductibles, meaning they're out-of-pocket expenses that they have to pay before the insurance will kick in. So patients are getting insurance plans that are $800, $900, $1,000 a month, and then their deductible is $10,000 for the year. Wow. So they're paying $800 a month, and their insurance won't kick in until they have medical costs that exceed $10,000. So the patient has to pay another $10,000 out of pocket before the insurance is like, yep, okay, we're kicking in now and we're paying. So it has nothing to do with the drug sometimes. It's really just the patient's plan and
Mhm.
how everything is laid out and what kind of pharmacy benefits they get and what kind of the way their doctor is trying to, believe it or not, if a provider doesn't put the right diagnosis code to get a prescription covered, it might not be covered. So there might be housekeeping issues with the way these things are prescribed by a provider, or so it's much more complicated than that the insurance just won't cover it, because they do, but it's a dollars and cents problem at the end of the day.
Hmm.
That's the sad part, right? Because you're 100% right. It's like, well, shouldn't this just be free for everybody, or at very little cost, or there should be an incentive, as you say, from the insurance company? 100%. But that's not the way insurance company works. Insurance is a for-profit organization. They're not out to do proactive things. That's not the business model.
Right. Sure.
Yeah. Yeah.
Okay.
So, yeah.
Gotcha. Hey
So
guys, love the
we at
comments.
MedMatrix, we don't go through insurance companies, because we can provide, and this is something I educate patients all the time. The reason why we don't take insurance or go through insurance is because we would have to perform the same level of healthcare that you're getting from your primary care, that you are upset about, and that you're lacking the care that you need. The reason why you're getting poor health care from all your specialists in your primary care is because they have to abide by insurance policy. We don't. So we can take an hour, a half hour to talk to you, to go through things, to run labs, to talk about all these options and lay out all of these different things and really change your long-term health, because we don't have to adhere to the insurance models. If we
Right.
did, we wouldn't be any different than anybody else. And we would just offer the same rudimentary, low level care that patients are really striving to get away from. So that's why we do what we do.
Yeah, 100%.
Yeah.
And
Yeah.
also to mention the other important components, like what are the other important markers that you're looking at on patients' labs that relate very closely to weight and weight loss?
Yeah, there's a lot. So and this kind of goes into just, how we evaluate new patients, but we want to check, their diabetes markers. We want to check inflammatory markers, what their thyroid is doing, sex hormones, nutrition markers, vitamin D, B12, iron. All these things play a significant role in the patient's baseline function. And if some of these things are not functioning well, again, it doesn't make the drug not work. It's just, how do we optimize the whole story? And that's really how we do it, is taking into account all these other things.
Mm-hmm. Yeah, I'm actually
Yeah.
going to share a report that a scan we do for all new patients, because I think this is really important here. Let me give me one moment here. There it is. The InBody report. Can you talk about
Oh,
this
yeah.
and the importance of tracking body composition while on a GLP-1 or losing weight?
Yeah, and this is, again, something that these online companies are not doing either. And this is really tangible, objective evidence of your body physiology changing. So an InBody is a measurement of your total body composition, not just how much you weigh, or your BMI or your height, but it's really looking at your body fat mass, like how much of your mass is fat, how much water you have in your cells versus outside the cells, how much lean body muscle you have. And then it will give us, as we go through treatment, it gives us an objective change in body fat percentage, how much muscle you've gained. And if something like a GLP-1, this is really important because we want to track any potential muscle loss, which I think we should talk about. This might be a good time to talk about it, but that's a really important piece of the metric that we're looking for, is body change. So obviously weight loss, fat loss, but we're looking for muscle monitoring as well. So these are really important tools we use with every patient as part of their monitoring, objectively, for not only GLP-1s, but just everything that we do.
Yeah. What is the,
Yeah.
how do I phrase this? Like, what is the ideal body composition journey of a weight loss patient on a GLP-1 look like? Like, what are the markers that you like on this that are moving?
Yeah. So what we're looking for obviously is weight, and people are used to weight because that's the only objective metric of their physical body that they've ever really been used to, right? From the time we're born, you get weighed, right? You go to the doctor, oh, you get weighed. Oh, step on the scale. It's like, oh, I don't want to. I've gained weight. I don't want to step on the scale. Oh, it's after the holidays. Are you going to make me step on the scale? Like, I know I've gained 10 pounds. So everybody is so used to their body weight, but your body is much more than just how much it physically weighs. So when we are on a GLP-1 journey, we're looking for changes in body fat, like the percentage of body fat, also the ratio of fat to muscle, and then how much muscle mass you will potentially gain in relation to fat loss. So as I've talked about on the podcast many times, one of the biggest longevity organs in your body is muscle. The more muscle you have, the stronger you are, the longer you will live. So one of our goals for patients is not to necessarily get their weight down, but change the way the physiology of muscle to fat works. So we want less body fat, more lean muscle mass, and that's part of the education piece of what we're doing. But as I said, GLP-1s can change muscle mass potentially for the like a negative. They can reduce muscle mass. So part of my treatment needs to be educating on how to prevent that and how to optimize that. So those are really the most important ways we're using this tool, and it's really, really important part of how we treat people. It's becoming a really important tool for just longevity monitoring for patients. And when they can see it on paper and they can also feel it, it's almost like a certificate like you get in like school for doing something. Like, look at my InBody. I've lost all this weight and my body fat percentage has gone down. I've had patients like, oh, I hang mine on the fridge, because it shows me like, yeah, I like circle my thing and it shows me what I'm accomplishing. So it's a really cool way to not only they feel it, but then they can see it. And it helps us chart progress. And it helps us also with data, right? It gives us long-term data on the work we're doing. Because the more we do this and the more data we get, the more we can put this together and sort of look at this as a whole of treatment plans and treatment approaches to obesity and metabolic syndrome when we have all this data. Because just saying a patient lost weight, okay, great, but this provides so much more than that.
That's awesome.
Yeah.
So many questions I have off of that. And I'm sure people in the audience have a ton of questions too. So guys, we're going to start doing some Q&A in about probably 10 minutes. So I don't know if we're gonna have time to do all the questions like we normally don't. But to start answering your questions now.
Ask your questions. Yeah. But we should definitely talk about some of the muscle pieces, Cole.
Yeah, that's exactly was my next question, which is why is muscle mass so important for longevity?
Yeah. Well, to pair this with the GLP-1. So one of the potential long-term effects of GLP-1s is muscle loss. So rapid weight loss can include loss of lean muscle mass. And some of the studies on GLP-1s are saying that if you don't incorporate resistance training with GLP-1 therapy, you could lose up to 40% of muscle, which is part of like all the weight loss that you've lost, all the weight you've lost. Approximately 40% of that could be muscle mass, and that's not good, especially for older people, older women. Muscle is a huge longevity organ. It helps us live longer. It helps keep your bones strong. It helps prevent heart disease and diabetes. So one of the biggest things that we have to do with GLP-1s as an educational piece of the treatment is to focus so much on diet, right? Tell me what you're eating every day, like verbatim. Tell me how much, when, what's the brand, how much, like approximate the quantity, because I have to make sure that the patient is eating enough to basically sustain this treatment. Because if they're going to go on a GLP-1 and eat a 200 calorie salad for each meal, that's not going to work, right? They've really got to focus on protein heavy meals. We've got to talk about resistance training. We've got to talk about the physical exercise piece of longevity and the goals of them losing weight. So that's a really important part of this for sure.
Okay, I'm going to ask you something that's going to challenge a lot of conventional thinking, what we've been taught, which is, and I hear you say this all this time, we should get this written on your lab coat, which is like, don't go into a calorie deficit to lose weight.
Right.
Or,
Yes.
or
That's my
don't
slogan.
don't starve yourself to lose weight. Like, why?
I'm gonna patent it.
Yeah, can you explain that? That's just like opposite of everything we've ever been taught.
Yeah. So when you eat less food than your body needs to exist. So basically, if you were to sit on the couch all day and do nothing but eat and go to the bathroom, your body will burn a certain amount of calories based on how large of a mass you are, right? How tall you are, how much body fat you have, how old you are. It's called a basal metabolic rate. So if you are doing absolutely nothing, you could be burning, depending on, again, your size, 1,200 to up to 2,400 calories just by existing, because you're still digesting, your body is still functioning, your heart's still beating, you're still breathing. So you're expending calories. So people that want to lose weight, they go into this mindset of, oh, I'm just going to eat less. That's how I'll lose weight. You will lose a little bit of weight initially because it's almost like a shock to the system of this reduced caloric intake. But after a while, you're going to plateau. And after a while, you're going to start putting on more fat because your body thinks it's starving. So if you are eating less calories each day than what your body actually needs to survive, your body evolutionarily is going to think you're in a starvation mode. And every piece of food you put in your mouth, even if it's lettuce and, all the good food, not that lettuce is necessarily good food, but if you're putting in really, really what you call good food, but it's not enough, you're going to store it as fat always. And people just don't understand that. Oh, I had a salad for lunch. Well, what was on it? Well, like an iceberg, and I squirted a little lemon, and maybe there was some carrots, and it's like, that's not food. That's like 100 calories worth of food. You don't understand. You need like 2,000 calories to exist. So if you're in the red all the time, that salad is going to be fat, believe it or not. And people just don't understand that. So eating the right amount.
So why is protein? So why is protein so important to eat when you're on a GLP-1?
Well, for the very reason I just talked about, is maintaining muscle mass. So if we are worried about potential muscle loss or muscle wasting as part of what happens with GLP-1s, proper protein intake is the best way to sustain muscle mass long term. And then also resistance training. So yeah.
Okay.
Yeah. And it's just, and we're gonna do for those listening, a podcast in the next few weeks just about nutrition 101, because I think it's so important to educate people. But this is one of the reasons why people have no idea how to diet. They have no idea how to live. They have no idea how to eat. And then they try weight loss drugs and they have no idea how to do that either, because they think they know how to eat, but they really don't. So then they're not getting the results that they want from the GLP-1. Then they do it for 6 months. Oh, I didn't really get any weight loss benefits, blah, blah, blah. I stopped it. Or I got some weight loss and then it came right back and actually gained more weight after I stopped it.
So wait, why does that happen? Because I think that's a lot of people's fears. Like, they go on a GLP-1, and I know this is what happens a lot when you go online, is like they do go on a GLP-1, patients do lose a lot of weight really fast, and then they gain it all back. Like, why? How do you ensure that you keep the weight off that you lost when on a GLP-1, or when you go off the GLP-1, that you keep the weight off?
So like I said earlier in the podcast, the drug does not fix anything permanently. It controls dysfunction temporarily while you take it, just like any other drug, right? You're on a blood pressure medication. If you stop it, your blood pressure is going to go back up. That's the way medications work. So we are not permanently fixing anything. And I was saying before, we had a conversation about some of the things that we need to look out for. If there's gut issues, if there's chronic stress issues, if people are not eating the right food, if they're sleep deprived, those are going to be issues that are going to prevent you from being successful. But the problem is patients are, say, going on the drug from the TV commercial that they saw, right? No one is counseling them on the diet, the lifestyle, the specifics, right? They need specifics. It's like, okay, Sally, you need to eat 30 grams of protein at this meal, 40 at this meal. These are things we want to be introducing. These are types of foods we can do. No one's doing that for them. So if they are trying to lose weight, that's the only intervention they're making. What's going to happen is they will lose some weight, but they haven't changed their lifestyle at all. They haven't changed the diet to be a pro longevity, pro weight loss diet. They come off the drug and they gain all the weight back because they haven't fixed the sleep. They haven't fixed the gut. They haven't fixed their hormones. They haven't fixed their diet. They haven't addressed their nutritional deficiencies. I mean, the list is endless. So it's really where guided supervision with a really seasoned provider is really, really important.
Yeah, totally.
Yeah.
All right, guys, we're at the 50-minute mark, and I don't see a lot of questions. I'm a little disappointed. We did a Lyme disease webinar the other day. We had to hang up. There was too many questions. So Diane, Brandy, Brittany, you guys are awesome. Keep it up. The other 40 of you, come on. We want to see some questions here. We love interacting with you guys. So put some questions down below. It's not a dumb. If you have a question and you think it's a dumb question, odds are it's not a dumb question. Someone else has it. So just ask away. Yep. We love interacting.
And we can't give medical advice, but ask questions if you have questions. Yeah.
Yeah, totally. So let's talk about like GLP-1s. Cause again, one of the advantages coming to when we work with patients is like, doing more than just a GLP-1. Like what are some of your favorite other tools outside of the nutrition that we've talked a lot about and lifestyle part that you like to pair GLP-1s with? Maybe other peptides, hormones. Can you expand on that?
Exactly that. That's 100% my answer. So that's actually a great question because a lot of patients have weight loss issues in a time of life where they probably need other help with other things, right? The hormone piece is huge, right? If you have metabolic issues, if you're over 50, obesity, diabetes, you probably are either perimenopausal, menopausal, or have low testosterone, right? If you're a woman or a man. So the thing that is really commonly done is pairing them with hormone replacement therapy, because what we can start to do is rewire the physiology of the body, right? Optimizing testosterone for a man helps improve muscle mass, helps with fat loss. That's what the GLP-1 is going to do as well. We're changing the dynamics of food. We're getting the diabetes under control if it's there. He's getting back in the gym, right? He's feeling stronger, a lot more motivated. Same for women, right? Their weight gain could be from lifestyle, but weight gain is one of the most common symptoms of menopause or perimenopause. So if we can get hormones under control, that is a great way that we can kickstart weight loss. But if we need a little bit more, we use the GLP-1, we use diet, we use lifestyle. Those are really, really commonly done things together. And then the other peptides, right? GLP-1s are a peptide, but there are other peptides that we use that can help with inflammation, that can help with immune function, that can help with regeneration of soft tissues if patients have injuries or surgery. So there's a lot of great things that we pair them with. And these patients do incredibly well. And it's really life-changing. I mean, it is incredibly life-changing to see some of these cases day to day.
Yeah,
it's really rewarding. Yeah.
I see a lot of testimonials from the clinic of just patients who kind of did the peptide hormone combo, and they're just like, man, my life changed. I guess last question before we get into like one of the games I have planned for us and Q&A is
okay.
Like why does aging make it easier to gain weight?
Why is okay?
Why as you get older, does it get harder to lose weight?
Harder to lose weight, yeah, because your physiology changes, right? And a lot of it is, a lot of it. I hear it so often, right? Oh, my metabolism's slowing down. That's not a thing. Sorry, not a thing. What's happening is your hormones are changing, right? Your metabolism is changing. Your food is not as good as you think. That's not going to lie. No tea or shade on any of our patients, but most people think they eat a lot better than they do. And every time I ask the question, so tell me what you eat. Well, they dance around it because they don't want to say, because they know it's not good. So as you get older, hormones change, physical activity changes, stress levels change, diet changes. So these are all things that you just have to be much more mindful of as you get older.
Sure.
So one of my goals is to really tell patients and educate them on, listen, this whole notion of, oh, I'm 50, so I'm just like going to slow down and just decrepit till I die. That's so sad, right? If
Mhm.
you live another 30, 40 years, you're just going to live very poorly for 30 years and just slowly decline. I think that's horribly sad. And unfortunately, that's the way the medical community outlines people's health. Like, oh, well, you're 50, like, it happens. No, it doesn't. It doesn't happen. It does happen, but you're allowing it to happen. So,
Yeah.
yeah, those are really some of the main things that we see in patients as they get older, but none of that is permanent. It's really just being more proactive about what you're doing with your body, more proactive about diet, more proactive about your physical activity.
Yeah, that's awesome.
Yeah.
I hope patients feel empowered by that and not scared.
Oh, I hope so too.
Yeah, because that's an awesome thing to go from like, well, I'm just getting older to like, oh wow, actually I can control this. I can feel better. I can continue to function at, the highest level.
Yeah. And I
all right.
really think like, and this will be my last point, but like in the medical community, how dare healthcare providers tell a patient that is not feeling well, oh, well, you're just getting older. Like that should be criminal, right? That is so sad for patients to just be told, well, you're just getting older and that's it. Like that, I
Yeah.
think that is so sad because it puts this psychological this sort of replay psychological verbiage on a patient's mind that my health will just continue to decline until I die. How depressing is that? So I'll never feel optimal again. I'll never feel as young and physically fit or cognitively sharp as I once did. I think that's really sad. I think it's really, really sad. And I hear it every day. Oh, my doctor just told me I'm getting older. It's just part of life. Yeah, it's really sad.
Yeah. This person just commented
my doctor blames everything on more menopause. Right.
Yeah,
well, do something about it, right? Give hormones, and that's one thing that I hear every day is women, sadly, they're female OBGYNs and female health providers who are probably going through the same thing. Well, it's menopause, nothing you can do about it. It's like, that is so false and it's so sad. And then when you're told that, from a woman's perspective, at say 45, 50, and you're planning to live a lot longer and you're trying to be active and you're trying to eat well and maybe you have grandchildren and you want to do all kinds of things, it's really sad for your doctor to say, well, this is just your life. Sorry. I think it's really sad.
Yeah, man.
Yeah.
And I think that's why patients love you and they love coming in. So
I hope so. Yeah.
Yeah, I appreciate that. All right, let's see. I got one game for us. We did it last time. I liked it. I think people liked it. It's kind of a nice recap of everything. It's just myth or fact.
Nice. Good. All right. Go for it.
So, and we're just going to run through. We got 15 and then we'll get, and then we got to do a case study. Then we'll get through the Q&As. All right. So GLP-1s are just another fad diet trend.
False. Myth.
If you stop taking the GLP-1, you will 100% gain the weight back.
False.
If you stop taking the GLP-1, you will 100% not gain all the weight back.
False.
GLP-1s will make you lose muscle.
Sort of, kind of depends. Yes, but not necessarily.
Okay. These drugs permanently damage your metabolism.
False.
If you need a GLP-1, it means you just lack willpower.
False. Definitely false.
Skinny people shouldn't take GLP-1s.
For weight loss, no. For other reasons, yes.
Okay, I feel like we should probably talk about that, but we might not have time. GLP-1s are unsafe long-term.
As of right now, no, but we don't know the answer to that fully. To be very clear. Yeah.
You don't need to work out when you're on a GLP-1.
Totally false.
All GLP-1 medications are basically the same.
False.
Nausea means the medication is working.
False.
Once you start, you have to stay on it forever.
False.
GLP-1 slow your digestion, slow your stomach so much they ruin digestion.
False.
You can't drink alcohol in a GLP-1.
You shouldn't. I won't say you can't. Yeah, shouldn't.
This is a silly one. These medications are only for diabetics.
False.
The higher the dose, the better the result.
Totally false.
Compounded GLP-1s are identical to the brand name.
No, false.
Okay.
Well, the active ingredient is the same.
Okay. If you plateau,
Yeah,
the drug
that's a hard
stops working.
False.
GLP-1s fix the root cause of weight gain.
False.
You don't
True
need
and false.
Okay. You don't need protein.
Some yes, some no.
Thank you. You don't need
Sorry.
Very good. You don't need protein if you're barely hungry.
False.
All right, last one. GLP-1s are a shortcut.
False.
All right, that was a lot.
Yeah.
Sorry, that was 20. That was not 15.
I was gonna say, how many did you do?
All right, last one. Let's. I love these segments. Let's do a patient case study of one of your most memorable GLP-1 patients.
And then we can answer some questions.
Yep.
So, actually, more recently, GLP-1 case of a patient who actually used the GLP-1 secondary. So patient, 60-something-year-old male, I think, 62 maybe, really, really poorly controlled diabetes. And what I mean by that is his diabetes markers in his blood were still really high, even though he was on multiple drug therapies at one time. And he was eating really well and was trying to be as physically active as he could, needed to lose maybe 30 pounds, right? That's not that big a deal. A lot of people have that issue. But he was really coming to me to say, okay, my endocrinologist is just pushing higher and higher amounts of all these different diabetes drugs. My diabetes markers are not changing. What the heck can I do? So really, really amazing guy. Was willing to do really anything to change his life and get his health in check, which is a great, great philosophy. And I love that mentality with patients. His testosterone was barely on registering. So I educated him and say, listen, probably the reason why your diabetes is so out of control and not getting better on these diabetes drugs is because you have no testosterone. And believe it or not, sex hormones like testosterone, progesterone, estrogen are very much needed to control blood sugar. They kind of work in unison with the metabolism. So I actually had a visit with him recently, and in 1 month, his blood sugar markers came way down. And he was off a couple of his diabetes medications already because his continuous glucose monitor was showing that he was becoming too hypoglycemic, or his blood sugar was getting too low. So we were able to use hormone replacement to start to control his diabetes, which he was so furious at his endocrinologist. Like, why didn't my endocrinologist know this? This is ridiculous. Like, they should know this. And I'm like, yeah, they should, but they don't. And then we started using a GLP-1 to help with, at a very low dose, to help with some additional weight loss and to help with the diabetes a little bit, because he had never tried it, a GLP-1 for the diabetes, and his other doctors were mentioning it, but they didn't want, they just wanted to add it to all the other medications. So we're using it as a way to help control the diabetes while he's trying to optimize his testosterone, and his blood sugar control within a couple months was just phenomenal. Lost about, I think it was about like 12 pounds in the first couple of months. He was working out. He was mentally sharp. He was feeling so, so good. So it was a great, great case using sort of what we were talking about a few minutes ago of how do we use a GLP-1 in conjunction with some other things that we do very routinely. So it was a really cool outcome. And it's only been a few months. I've only been treating him, I think, since December. So nice. Yeah. That's
awesome. Wow, December.
Yeah.
That's a great start to the new year for him. That's
yeah,
awesome.
And he was dealing with this for 20 years. Like, my diabetes has been out of control for 20 years. And I'm like, oh God, okay, well, how am I going to fix this, right? And okay, little testosterone, little GLP-1, and there you go.
Man, and simple. That's a great endocrinologist is for your hormones, right? Like,
right.
What he's focused
on.
Oh,
yeah. He was furious. He was furious. He's like, I've been seeing my endocrinologist for 15 years. Why in the hell did no one ever tell me that my testosterone was low and that could be affecting my blood sugar? Like, I don't understand why they don't. And I get these questions every day. I just don't. It seems so simple to me because it's the work I do. And when you explain it to patients, patients are like, yeah, that seems so reasonable. I get that. I don't have any type of healthcare degrees. I get that. Why doesn't my doctor? I don't know.
Man,
don't know. Yeah.
Well, it was an awesome story. Thank you. Now we're going to try to answer all these comments.
See what you did, Cole?
Yeah,
we're going to be here all day.
I appreciate you guys listening. I don't know if we're going to be able to answer all of these, but we're gonna do our best. Dr. Nard, just let me know what your time constraint is. I have a hard stop in 10 minutes, so let me know when you're
fine. Yeah, we'll go till your hard stop. We'll just answer them really quick. I'll just give a few quick thoughts on some of the questions.
Awesome.
All right, so if you want to pull them up, I'll answer them.
Yeah, I'm just going to put them on the screen and then you can read them.
Perfect.
Let's do this one. Where to start?
If it probably the GLP-1s calms immune cells, does it create any lowering in immune response? Like, would you be more likely to get sick? Absolutely not. No, it's not affecting your immunity. It's not lowering your immune system, your immunity's function. What it's doing is it's providing anti-inflammatory benefit on the immune system. So in theory, could make your immune system better, more functional.
All right.
Not lowering immune response. Yeah. Great question.
Loving all the lives. You're welcome.
You're welcome. Medicare will cover. Yeah. So wondering if at all helps meds are the same. A friend got mine from a social media site and she lost weight quickly. Is that safe? If people are getting GLP-1s from online resources, it's not that they're not safe. I mean, you certainly can do that. There are online companies that offer the meds and they just mail them to you. It's not that it's not safe. These companies are regulated by the powers that be within the federal government and pharmacy distribution. But it's just my issue is there might not be a lot of hand holding and a lot of work that you're doing with a provider on other things. So.
Yeah, and what about the just rebound too, right? Getting off of it, like they do a great job at helping you get on it, but what about getting off?
Right. They'll certainly take your money, and a lot of these companies are membership monthly, so you pay whatever a month, and you get your GLP-1, and that's all you get. You don't get a provider, you don't get any help, and then it's like, okay, now what do I do? Like, do I do this for a year? Do I do this? So it's a really it feels nice to start, but then now what do I do? Mm-hmm. So yeah,
totally. All right, let's keep going. Where's MedMatrix, Dr. Nard?
We are in Portland, Maine, South Portland, Maine.
We see patients in Maine and New Hampshire.
In New Hampshire, yep. If you're interested.
Let's see.
Talk about how it curbs addiction. So there is some thought about this. In terms of
for these questions, can you just give context for those who are just joining?
Sure. Yeah. So the question is talk about how it curbs addiction. So the GLP-1s and if it curbs and controls addiction. So we didn't get into all of them. Unfortunately, we had so much to talk about, but what the GLP-1s are actually doing in the body, the different layers of the body. So one of the things that the GLP-1s are doing is it's affecting the dopamine pathways. So dopamine is one of your neurotransmitters. It's one of your feel-good hormones. So because it affects dopamine, you have less emotional eating, reduced compulsive snacking, and also there's some studies that show that it might be reducing people's addiction for alcohol and also certain drug users. So there is some promise that because of what it's doing in the brain, it might help people overcome addiction.
Cool. Love it.
Yeah. Very cool.
All right, so let's broaden this question. So, can GLP-1s cause body aches? If so, what is kind of going through your head if a patient's on GLP-1s and are getting body aches?
Some of the common short-term side effects we went over, and one of them is fatigue or low energy. So, if there's body aches, is that fatigue? Not sure. Is this something that we've seen? Sure. If it's more serious or long-term, that's something that would need to be talked with your prescriber.
Mm-hmm. Okay.
Yeah.
Here's a great one. I know you'll like this one.
How much resistance training is needed to preserve muscle? Yes. So it depends. It depends on your age. It depends on your gender, and certainly what your goals are. But if you are of any age, you need to lift things that are heavy. Not heavy enough to hurt yourself, but that is how you stay young. Muscle is an ultimate longevity molecule. The longer you want to live, the stronger you have to be. So most people, if they're in older years, say over 50, 3 to 4 times a week with resistance training. I'm in my 30s. I work out 6 days a week, but I'm a bodybuilder. So I do not counsel my patients the way I live. I do things very differently from an athletic perspective, but you really need to be in the gym a few times a week doing resistance training at any age.
Perfect. And that's something you help patients with, right? Just kind of give them clarity.
All the time. Yeah. Yeah.
Cool.
What are some good sources of proteins that you recommend? So some of the top things, obviously the, lean animal proteins, trying to buy organic, the chickens, organic grass-fed beef. I really love some of the, I don't want to say beef alternatives, but there are really great red meat alternatives, like gaming meats, like bison or venison or elk. They're really, really high in nutrients, really low in pro-inflammatory fatty acids. So things that are not cow beef, the other type of gaming meats are really, really good for you. Obviously, fish, really good. You want to stay away from really, really big fish like swordfish because they have more mercury in them. So we're going to do a whole podcast on nutrition. So stay tuned.
Yeah, that'll be, if you want to tune into the nutrition podcast, definitely follow us on YouTube and Instagram. And then if you're not on our email list, join that because we send them out to our email list.
Yeah, I'm excited for that. That'll be fun.
Yeah, great job with the questions, guys. These are awesome questions. This is a good one.
Calculate calories to lose weight and not to go too low. The best way to calculate how much calories you need is something called a basal metabolic rate. Go online, type in BMR calculator, and you put in your demographics, your age, your weight, how sedentary you are, and it will give you a breakdown of how many calories you should be eating each day just to exist. And that's a great foundational place.
Yeah, and if you want a more accurate response, the InBody, actually, you see it right here on the right column, about 5 down, basal metabolic. So it'll actually tell you more personalized.
Yep. So this particular example, basal metabolic rate, 1,231 calories. Yep, it's great. Are there newer top drugs coming on the market? Will they be better for weight loss inflammation? So as of right now, there are other GLP-1s that are not commercially available. And there was a question in here somewhere, and this whole myriad of questions asking about retatrutide. Retatrutide is a triple hormone agonist. So Ozempic is a single, tirzepatide is a double, retatrutide is a triple. It's not commercially available yet, so we can't prescribe it, but it's being studied. But I have no idea if it will ever be on the market. Tirzepatide is, in all reality, there is billions and billions of dollars being flooded into tirzepatide research and manufacturing. So if they were to introduce a third drug that outperformed tirzepatide, all that money would be wasted. So there may be in the future, but this also is a business too, from these pharmaceutical companies making money on these very expensive drugs. So I don't know about retatrutide in the future.
Do you think a clinic like ours will have access before it's like a commercially available?
If it's not FDA approved, we can't prescribe it.
Okay, gotcha. So that would happen simultaneously.
Correct. Yeah. Will this help with hormones and cholesterol? So yes. Won't help with hormones necessarily. GLP-1s don't increase your hormone levels, but it certainly can help control cholesterol levels. It can bring down triglycerides. One of the main reasons why triglycerides are elevated, which is a measure of fat in the blood, is really because of blood sugar imbalance or pre-diabetes. So if the GLP-1 is controlling the blood sugar, it will lower your triglycerides.
Yeah, great stuff. Love to hear that.
Yeah.
Give us hope 52. God bless you,
Amy. Good. Thanks, Amy.
Love these podcasts from Instagram.
Awesome.
Thank you.
Awesome.
Another one about cholesterol. And what do we did a whole.
Can they help with cholesterol?
Yes,
we did.
Yeah.
A couple of weeks ago or a month ago, we did a whole podcast on cholesterol. So we gave a lot of information there, but can they help with cholesterol? Yes. What number do I consider high? Go listen to the podcast. It's all in there. The
Yeah.
myths of cholesterol, $200 billion cholesterol industry. It's all a myth. Go listen to the podcast. It's very informative.
Yeah.
That is exactly what my NP told me. That's why I came to you. Awesome. We love to hear that.
That is awesome. Thank you.
My spleen was removed. There's something in here. My spleen was removed without an issue. I'm not going to give specific medical advice, but having no spleen is not necessarily a contraindication, but you'd have to check with your doctor, of course.
Cool.
How do you, this is a great question. The one below that, Cole, maybe we end with this question.
Perfect. And then Amy, yes, we, if you're the first appointment, you would have to be in person to do the labs and then the body scan. And then after that, we can do telehealth depending on where you're coming from, or we can see you in person. Yeah, we are going to promote, do a little promotion here at the end for patients on the webinars. So if you want to stick around for that, for new patients.
How do you help people to stop GLP-1s? I've been taking for 1.5 years and have lost weight without losing muscle. My GI side effects are bad. I'd like to stop. So really, it's about titration. I'm not going to give specifics about dosing or anything because I don't know the specifics of what you're doing, but it's really a guided titration reduction in the dose over a period of time, and then also optimizing the diet piece in conjunction with that. Those are two really important things. So that's the best way to titrate down.
Perfect. Whoever asked the question about cholesterol, the media manager just commented the link to that episode. So if you're on YouTube,
nice.
click it. She made it easy for you. Or you can just YouTube MedMatrix cholesterol and we'll come up.
We had fun. That was okay.
Yeah.
That was a good one.
That was really awesome. Here's one, and I want, if you could just answer, I think obviously it's important that people understand this distinction between a peptide and GLP-1 being one and the same. And then also if you could just talk about the like research peptides that people get online that are not through one of the, if you can just explain this and then also explain the whole research pharmacy peptide.
Yeah, this is probably a good place to end. We can talk about this. So
I agree.
A GLP-1 is a peptide. I said that when we started the podcast. So GLP-1 stands for glucagon-like peptide 1. It is a peptide. And a peptide is like a signal for the body to do something. It's a signal and a receptor. So peptides can be used for many different things, from weight loss to muscle metabolism to immune system support to regeneration of soft tissues, anti-inflammation. So GLP-1s are type of a peptide. And is it recommended for specific people for each? So it depends on your goals, but we had talked about earlier in the podcast that you can do certain peptides with GLP-1s, and I do that all the time, depending on what people's goals are, depending on what their chief concerns are, what we're trying to accomplish long-term for their health. But yes, very commonly done together for sure.
Perfect. Cool. All right, guys. Let me see here. So we do something special for patients, people who join us on the webinar. We notice that patients who come into practice who are educated, they're excited, they're motivated. These are patients who get better results. We love that you guys are actually taking the time to educate yourself about your health. So we don't normally do discounts like this, but if you go to this page, there's a $200 discount as a new patient available for the next 39 minutes. So you have to do it now if you are interested.
Nice.
We only accept a limited amount of patients per week. So if you are looking to get this type of care for your own health, copy and paste that link, go to your browser. There's a QR code that you should be able to scan at the top of the screen. And yeah, we are excited to work with patients who are taking the time to educate themselves about their health, because it goes both ways, right? It's you got to have a provider who knows what they're doing, they're investing in your health, and as the patient, you gotta put in some work too, and that's when we have an amazing healthcare experience. So,
definitely.
Yeah. With that said, though, that was an awesome episode. We answered a ton of great questions. I learned a lot.
Yeah, thanks for everybody's questions. Yeah,
we're going live on nutrition in a week. Within a week, we'll be sending out information about that. If you want to join the nutrition episode, Dr. Nard, anything you want to say to take us home here?
Yeah, I mean, we covered so much. I hope people learned some things. And I want to make sure that people don't look at this as a cop-out. Don't look at this as cheating, right? I've had patients tell me all the time, like, yeah, I don't want my husband to know I'm doing this. I don't want my friends to know I'm doing this. There's like a certain level of shame with weight loss medications and just weight loss in general because it's a little bit taboo still. But I think it's really, really awesome if a patient comes to somebody and says, listen, I know I'm not well. I know I'm struggling. I need you to help me lose weight. I really need to better my life. I think that's awesome, right? You shouldn't be ashamed of that. Whatever tools that are used to get to that end goal, I think is amazing. So never be ashamed of the things that you use to improve your health. It's all about you and your goals. So that's where I'll leave it. So we covered a lot. I hope people learned a lot, and we're excited for more.
Well said. All right, everyone. Thanks for joining. Dr. Nard, thanks for